Welcome everyone. My name is Mary Clow. I am an Indiana State University nursing school student, and today I'd like to discuss how to prevent limb amputation with you to help raise awareness of peripheral artery disease in our minority communities. Right now, if I could get you to please pause the video for just a moment and take my pre-test, which includes some risk assessment questions to see if you might be at risk for peripheral artery disease. Thank you. Welcome back. This is what we are going to learn today. What peripheral artery disease is, its signs and symptoms, ways to prevent it from happening, communicating with your healthcare team, formulating a plan in the event of an emergency, and screenings in your community. Peripheral artery disease is basically a buildup of fat, as you can see right here, that hardens and narrows the blood vessels. So this yellow here should not be here, but because it is, the red over here is smaller. Instead of being as big as the two of them together, it's only right here in the red. What peripheral artery disease does is narrow or block the blood vessels that go from the heart down to your feet. So if you see these vessels, all the little vessels, any of them can become narrowed or blocked. Every year, over 200,000 Americans will undergo amputations. 130,000 will have diabetes mellitus as a risk factor. The highest rates of amputation are among Native American, Hispanic, Latino, and African American populations. These populations, for various reasons, will also be diagnosed at a later stage and a more severe case. They will have an increased risk of heart attack and stroke. 80% will die within 5 years of an amputation. So these populations are dying younger. Here are some of the risk factors that we cannot change. Having a family history, age, usually older adults, smoking, and Native American, Latino, Hispanic, or African American heritage. But there are some risk factors that we can change. Controlling your glucose if you have type 2 diabetes, quitting smoking, managing your high blood pressure, losing weight if you are overweight, managing your cholesterol and your blood pressure, and increasing your physical activity. All are risk factors that we can change. Symptoms of peripheral artery disease vary from person to person, but here is a general list. Pain, aches, or cramps that stop with rest. The pain is located usually in the buttock, hip, thigh, or calf, and the pain is in the muscles, not in the joints. Wounds that are slow healing, particularly in the foot or the toe. A noticeable decrease in the temperature of legs and feet. Poor growth in the toenails or hair growth on legs. The legs will be smooth and shiny. Erectile dysfunction, especially in men with diabetes. People with PAD have an increased risk also of coronary artery disease, heart attack, or stroke. Untreated PAD can lead to painful symptoms or loss of a leg. Even though this information may be upsetting, Know that you can prevent amputations from happening. Keep scheduled doctor's appointments. Make sure that you're controlling your blood pressure and your cholesterol. Take prescribed medications. Talk to your doctor and let them know if you are having any symptoms. If you haven't been screened for PAD, ask your doctor about getting screened for peripheral artery disease. Change your diet, exercise, quitting smoking. These are all things that you can do to help prevent amputations. Everyone with risk factors needs to be screened for PAD. This especially goes for people with diabetes. Do not wait. People with diabetes have an increased risk of wounds that don't heal by themselves, mainly because of neuropathy or nerve damage in their feet. Health communication is more accessible than ever in this age of information technology. The Community Preventative Services Task Force estimates that 95% of the population has access to a smartphone. 1 in 5 people will have downloaded a health app, and 62 to 72% of people will have searched for health information for themselves online. Evidence-based practice gives us some strategies to help obtain our goals. You can now speak with your doctor or nurse over the telephone. Telehealth visits are enabling patients to speak with their provider from the comfort of their own home. Text messaging and downloading apps enable information to be sent to the provider, such as checking and monitoring glucoses. There are many reasons that people may put off seeking help for their symptoms. They may not have transportation. They may not have a primary care provider or even have health insurance. People may be concerned with the expense of treatment. They may be worried about missing work or just not understand the importance of seeking treatment. 1 in 4 Americans know what PAD is, and less than 1 in 7 understand that peripheral artery disease is the #1 reason for leg amputations in this country. We are ending this presentation with a quote that is so fitting. You have so much power to bring awareness, prevention, and change. Here are the websites I used in the making of this presentation. Feel free to have a look and help raise awareness by sharing with a friend or family member. Thank you for joining me for this presentation, and don't forget to take the post test at the end of the video.